How does hypoxia affect COPD patients? Imagine trying to breathe through a straw all day long. That's what it can feel like for someone with chronic obstructive pulmonary disease. When the lungs get damaged, they struggle to get enough oxygen into the blood. This condition is called hypoxia. It happens because the tiny air sacs in the lungs, called alveoli, aren't working properly. They can't exchange oxygen and carbon dioxide as they should. As a result, blood oxygen levels drop, and tissues in the body don't get enough oxygen. This shortage makes breathing even harder and can cause a range of symptoms. Shortness of breath is the most common. Patients often feel like they can't take a full breath, especially during activity or at night. They might wake up gasping for air or feel tightness in the chest. Hypoxia also causes rapid breathing as the body tries to compensate for low oxygen. Coughing and wheezing become more frequent, and physical activity becomes more difficult. When oxygen levels stay low for a long time, it can lead to serious problems. The brain needs oxygen to work properly, so hypoxia can cause confusion, dizziness, or even fainting. It can also lead to bluish skin or lips, a sign that oxygen isn't reaching the tissues. The muscles weaken because they don't get enough oxygen to function well. Over time, low oxygen levels can cause high blood pressure in the lungs, called pulmonary hypertension. This puts extra strain on the heart and can lead to heart failure. Chronic hypoxia can also increase red blood cell production to try to carry more oxygen, but this thickens the blood and raises the risk of blood clots. Managing hypoxia is key for COPD patients. Doctors often prescribe supplemental oxygen to help raise blood oxygen levels. This can improve breathing, reduce symptoms, and make daily activities easier. It can also help prevent complications like pulmonary hypertension and heart problems. Oxygen therapy is usually given through a small device called a nasal cannula or a mask. The goal is to keep oxygen levels above a certain point, usually around 90%. Sometimes, patients with mild or intermittent hypoxia might not need oxygen all the time, but regular monitoring is important. In the end, understanding how hypoxia affects the body helps patients and caregivers recognize the importance of treatment. Keeping oxygen levels in check can make a big difference in quality of life and overall health for those living with COPD.